All right, I got three after. We're going to go ahead and be cognizant of your time. Again, welcome to our presentation. This is the Chapter Support Committee. And our hope is today that we're going to give you some ideas on making being a chapter leader easier. So our title is From Overwhelming to Easy, Chapter Leadership Simplified. So we think we have a lot of answers for you today. So we will see how that goes. I'm Beth Mooney. I am the chair of the ARN Chapter Support Committee, and I'm also the president of the Arizona chapter. I don't know how to get rid of that. You guys see this thing here, or is it just on my screen? Oh,
You're showing the presentation slides, so they look good.
okay. Okay. All right. Sounds good. Okay. So the first thing that we're going to talk is we're going to ask Donna to talk. We have several people presenting from different chapters. So the first is Donna Williams from the Northern California chapter, and she's going to talk about the role of chapter volunteering. So, Donna, I think you're on mute. Looks like you're on mute.
Okay.
There you go.
Just trying to figure out how to get there. Hello, everybody. I'm Donna Williams, past president of ARN, past president of the Channel Islands chapter, past president of the Northern California chapter, and current president of the California chapter. And I love volunteering for ARN. So I'm going to try and answer a couple of questions. Want to go to the next slide? So it can take on so many roles. It does not have to be a big thing. It can be a little tiny thing. You can do one little thing for your chapter. You can organize a meeting. You can volunteer to decorate. You can sign people up for meetings. You can reach out to others on your chapter. Helping with things really is what the chapter is really what makes the chapter run. You can speak, which is challenging for some people, but the more you do it, the better it gets and the easier it gets. You can work on committees or task force. The chapters are always looking to make things go better, and we love new ideas. So any ideas you have that you want to put in place. And then there's, of course, the board positions, which do take a little bit more time and effort. Next slide.
Oh, did I go?
You went backwards.
Sorry about that.
So I was thinking about this one. So what does volunteering look like? So are you thinking it's work only? Well, it isn't. But the first thing I was thinking about today was I have so much fun volunteering. I have met so many people by my volunteering over the years, and I've been volunteering for ARN since 1989, I think. So what are the other things that you gain? Well, there's recognition at work. You gain invaluable work experience. It's good for your resume. It's good for you to show your leadership that you are engaged in your chapter. It helps your unit that you're engaged in your chapter. It helps you to advance professionally, and for me, I think it has helped me to advance personally. I would not be where I am today if it had not been for ARN and the possibilities to have multiple different volunteer roles. You can truly make a positive difference as you consider what the chapter needs and then consider what big ARN needs. It improves your self-esteem and confidence because you're active, you're participating, you are giving your ideas, you're gaining your ideas, and you are interacting with other people. And there is no way that just working in a role at any given situation is going to give you the experience that you get when you volunteer, or the joy, or it's a different type of satisfaction that you get from volunteering from that we have in our work roles. So you think you don't have time. Well, it really can be pretty flexible. As with any project, there are timelines, but you do have some flexibility. It is not a work role. So one of the things you need to think about is, can I do this outside of my work hours? Because truly, this is volunteer. You're not getting paid to do this, but it is really for you, for your chapter, and for the association. I don't think there's another one. Is there, Beth?
There you go.
Ah, of course. How often do we hear that it takes a village? We are really not in this role all by ourselves. We don't have to do it by ourselves. And we shouldn't be doing it by ourselves. We need to be leading others. We need to be sharing with others. We need to be developing others. And as we go through shared leadership, we all have the ability to grow individually, personally, professionally, and help each other do that. By working together in shared leadership, we have a common goal, and then we have success that all of us can recognize because we have worked together for it. And it goes back to being, what is rehab? We are really good as team members. That's what rehab is all about. So for us to take on volunteer roles and shared leadership, it is really what we do best. And our chapters can take advantage of that. We can take advantage of helping our chapters and working with each other to get to achieve our objectives.
Sorry about that, Donna.
That's okay.
My finger hit the button too soon.
That's all right. Wasn't sure on the time frame. So, and that is, I'm in the airport waiting to board a plane. So thank you so much for coming here. I hope to see you all in August and talk more about volunteering for the association. Thank you.
Thank you, Donna. So I'm going to now talk about a different kind of approach that we've taken with the Arizona chapter, making leadership volunteer friendly, and then really looking at different roles so it does help us have to do less work. So a little bit of history. We actually, right now, the Arizona chapter has been established since 2015, but we were established before that, probably back early in the 2000s. And we lasted for a while, but we actually folded because we had the same 4 or 5 people doing everything year after year after year. And so we just didn't have a lot of member engagement. So the chapter folded, was probably dormant for maybe 5 years or more, and then it got revived in 2015. It does include the entire state. We are considered a large chapter because we have 104 members. But what we did is we created 12 board positions, which is probably different than a lot of what you guys have, and we'll talk about that. And then our chapter, you are elected for a 2-year term. So we have the traditional president, the president-elect, the secretary, and the treasurer. But then we start and we identify different roles, and that's where we kind of branched out. So we have, as you can see, 8 director positions. We have a director of social media. We have a director that's a CEU coordinator. We have a director that's the education coordinator, a director of member outreach, a director of member engagement. We have a director of the annual conference coordinator, and then we have a couple director at larges. And so what I'm going to share with you is what each person is responsible for. And you might, when you look at those positions, you might go, well, why isn't the CEU person the education coordinator? Again, we wanted to make the positions with minimal work, right? Because it is volunteer and everybody's working a full-time job and work is, demanding. So we really tried to divide it up, but then we really wanted to also let people know exactly what they were going to be responsible for. So the president has their traditional responsibilities, coordinates the chapter meetings, makes sure that we go by the bylaws to guide our chapter compliance, make sure that the board members complete their duties as assigned. We're actually, the president is a liaison between the chapter and the chapter support committee, and then assist the treasurer in managing the financial responsibilities. So the annual report that needs to be turned in, we work very closely with the treasurer. And then our role is then to mentor the president-elect. So what we do is, instead of like a traditional vice president, we have a president-elect. And so that person works with the president, and then at the next election is automatically moved into the president position. So the president-elect fulfills the obligation of the president when they're absent. They work side by side with the president to become familiar with what that role is. And then we assigned them the completion of this chapter scorecard. So they oversee that. So they're the ones that bring the chapter scorecard up at each meeting and to see where we're at, what we've completed, what we need to do. So they own that. Secretary is responsible for recording the meeting minutes. They maintain any chapter records. They send out communication for meetings and events. They also coordinate the formation of the quarterly newsletter and send it to members. And they are the primary communicator from the chapter to the members. Then the treasurer has a traditional fiscal responsibilities, is responsible for monitoring our chapter funds, records all income and expenditures, maintains our bank account. The president and the treasurer both have cards to the bank account. They keep the board and the members informed of the chapter's financial status, and they are responsible for submitting that annual financial report each year. Now here's where we get into the different positions. We have a director of social media. Fortunately, we have somebody who loves social media. So she is just great with that. She's actually gotten our website up and running. She got us on Facebook, Instagram, X, LinkedIn. So she makes sure that we're out there on all of those platforms. And then she also communicates all chapter activities on the ARM member circle, and she makes sure that all of our activities are out there on our social media sites. She actually managed we have an annual conference, and she made sure that that was on our website and people could go on there and register and, for the conference and all of that. And then we have a director of a CEU coordinator. We're lucky that one of our board members, that's actually her job with her work. And so her work has allowed us to get our CEUs under their license. So she completes all the required documentation for CEUs for educational offerings and takes care of that and manages that for us. And then we have a director education coordinator, because that CEUs is, kind of a full-time job in itself with our quarterly meetings and our annual conference. We really wanted someone else to be responsible for making sure we had education topics. So we have a director of education coordinator who coordinates our educational offerings and distributes educational flyers. And this is, they find the speakers for us for our quarterly meetings. And then we have a director member outreach, and they're responsible for coordinating membership drives. They coordinate visits to rehab organizations to educate on ARN and the benefits of joining ARN. And they follow up on the prospective members on the benefits of joining the local chapter. So, each month when you get your list of members, you have at the very bottom of your member list is a group that is prospective members. And those are members that have joined National ARN, but have not joined your local chapter. So it's this person's responsibility to reach out to those members to let them know, because a lot of times they don't even realize they don't belong to the local chapter. We have a director of member engagement, which is different, and what they do is connects with the new members and welcomes them. They also utilize a member roster to engage members in chapter participation. They assist in recruiting members to become board members. They also coordinate the biannual general board elections. They assist in implementing engagement strategies for growth, and they participate in special projects as assigned. Then we have a director of the annual conference coordinator, which is a new position, which now that I'm stepping down as president, I volunteered to be because I love putting on the annual conference. That's just a fun thing for me to do. So my role as the annual conference coordinator will be to coordinate the annual conference activities, ensure that the timelines are met for the conference center, vendors, and speakers. And then we have, again, 2 director at large positions. And if we have more people that are interested being a director at large, we will actually add those. We'll vote and add more director positions. And so you can see we went from a minimum of 4 to 5 people that were always doing everything to now we have 12. And our philosophy is the more people that can get involved in the board, the more that those responsibilities are shared and people have less to do, so they're more engaged and more apt to do it. So far it's been successful for us, and so we're excited about this model. Now we're going to hear from Yvette Salas on the Florida chapter.
Hi, my name is Yvette Salas. I am the president-elect for the Florida chapter. I also serve as the healthcare policy chair for Florida, and for the ARN organization, I serve as healthcare policy chair. And I've been on healthcare policy for several years. I really enjoy serving in that capacity. And it's really made me more familiar with rehab nursing, how the ARN works, what needs to be done, and how we as members can support one another. So very interesting. If you're looking to volunteer for ARN, I really highly suggest that. Okay, next slide, please. Okay, so I wanted to talk a little bit on steps to active chapter volunteerism, similarly to what Donna spoke about, and how you can make it easier to volunteer. So the first thing you really need to do is increase your membership. And we can do membership drives. In Florida, we have a lot of case managers who serve with us. And so you can reach out to your American Case Management Association, or CMSA, look for your local organization, send them a letter requesting membership. A lot of them are really like workman's comp cases. They're working with patients that have a lot of rehabilitation needs. And so they can really increase your membership and can be very helpful and informative in bringing education to your chapter as well. So many hands make light work. The more help you have, the less demanding the volunteer role will feel, just as Beth said. So breaking those roles down, I felt like that really summed up that part of my slide. So thank you, Beth, for sharing that. When you describe the roles or duties you need help with, it helps people realize like they can do it. At first, I was really nervous when I signed up for health policy. I have a master's in health policy, but it didn't really teach you how to become an activist. It just kind of gave you groundwork. So I was really nervous, but when I looked at what it would require attending the meetings, I'm like, okay. And so I'm setting up Georgia. We're helping that chapter get off the ground. And I just broke down the role, like, hey, in order to become a member or an active leader in this chapter, really you only have to have 4 meetings a year. And that's so simple. So when I broke it down like that, I had several people sign up. So it really is not as much as it sounds like, oh, I'm volunteering for something. Just break it down and make it really easy for people. Contact other chapter leaders for ideas, like Beth just did with sharing what Arizona does. Florida's always available for helping. And then use other models that work in your community. So look and see who else is successful. Does the Red Cross have a lot of volunteerism? Is it a local church that's always doing a food pantry? See what's working for them, and maybe you could take some of their ideas as well. So you just don't have to model after ARN, but you can look to see what makes people in your community jump at the idea to volunteer. Next slide. So increasing that chapter membership, CRRN testing time is great time to increase membership. So anyone that's sitting for the June or December testing, sometimes local chapters, you can offer scholarships for the testing. That's one way to do it. But also encourage the members that you have now that if the CRN candidate joins the ARN, that they're actually going to save $5 to $10 than if they paid for the test without membership. So it's a brilliant way to get staff in your local facilities involved in ARN, and then once they're involved, you can tap them for volunteerism. So it's a win-win. Also send a blast email to your state's prospective members that are not listed as CRRNs. So a lot of times the chapter members that we are on chapter support will be sending emails out to the different chapters, and a lot of people are prospective members. And so reach out to them. That's handed right to you on a dish. Plan to do this in March and early April, and again in September and early October before the deadline for test registering. So especially for those CRRNs, you want to try to get that information out as early as possible so that when they register to take the test, they know that they could click membership and it's going to save them money. I also visit local inpatient rehabilitation facilities, skilled nursing facilities, and VAs. Or if I'm not able to make a physical visit, I try to find somebody in a leadership role and send them a memo and propose to them the benefits of ARN membership to their staff. And that works out really well. Also, local nursing schools. Every time we have a nursing school in our IRF, I get in front of those students. I talk to them about what it means to be a rehab nurse and that they can join as students. So student membership is a great way to get people involved early. That's actually how I started. I was working on my master's and I said, oh, wow, a student discount, great. And so that's how I really got involved in ARN. So hone in on your nursing students. Next slide, please. And then encourage growth. Don't turn anyone away. Finding something for them to do is easy. People need to feel valued and that they belong. Sometimes when you have long-term longevity within your leadership roles, we tend to, martyr ourselves and take on things, and then we don't want to give it up. Like, I don't know if they're going to do it right. I'm afraid that the new people are going to do it wrong. And so people feel like, they don't really need me because I volunteer and they don't give me any jobs to do. So don't shy away from that. Mentor them to become that leader that you are so that they could carry on the way that you are currently doing it. And if it's not the way it was always done, but it gets done, be grateful. We can be too critical of newcomers to an organization, like, that's not the way we always did it. And so that the next year, those people aren't going to show back up. So just take it with a grain of salt, be grateful that you have been able to shed one piece of your workload, and just keep mentoring them. Eventually, they'll come to your side if it's really the right way it's being done. But there's nothing to say a little change is good for everyone. And then as your chapter grows, you can add committees like we've seen that Beth had shared. And so we in Florida added a lot of leadership. So there's a leadership committee. And so we don't really have them broke down as like say chair seats, but we have them sitting in the leadership group, helping us with education ideas. Hey, I know somebody who's a good speaker on this. And so we're able to kind of do like she did with an education group. And they kind of fall under leadership. And then, of course, health policy is another one that you can get people involved in. Bylaws, and sometimes bylaws don't even need to be changed, but it's a way to get somebody on the call and they get interested. Like bylaws probably is really easy until they need to be rewritten. So you could get somebody involved by giving them that title, and then they're attending the meeting, and then the next year they're like, okay, I'm ready to do something a little more engaging. So giving them something really easy that just gets them to know the people, to get the flow of the meetings is a good way. And you just need a willing heart. And once you have a willing heart, capture that person. Don't let them get away from you. Next slide. Okay, so breaking it down, volunteer work with ARN is not that demanding. Like I said, you just, for the chapter board, once a quarter, so that's 4 times a year for 1 hour. So I think anybody could do that. When you simplify the time demands, people will be more willing to volunteer. And I really thank you, Beth, for your presentation, because showing how you've made some of the roles, like the education role, breaking that down to CE broker and then education support. Boy, that's really what it's all about, so that it's not overwhelming for one person. And when you're planning a conference, making sure that you have conference committees, like somebody for the vendors, somebody for the facility that you're hosting it at. Just breaking that all down and giving each person a job. And then that job will be done really well because you're not overwhelmed and you're building your organization. Next slide. Okay, the president usually runs the meetings, so I just wanted to share this, like if you were new to your chapter, this is kind of how it works. And then the vice president assists with any education or conference planning. This is how we do it in our group. Secretary needs to document attendance and the meeting flow and then any discussion points. And the treasurer will receive funds from membership dues from the ARN and any activities. And they also need to maintain the bank records. Once you have a lot of funds coming in, you could even break that down to a treasurer and then a finance chair. And so our finance chair kind of just keeps an Excel log to make sure that the funds are actually going where they're supposed to go. So it's like an oversight position. And that kind of helps the treasurer make sure she's not making any errors. So it's just breaking it down, really. And then the next slide. Model positive behaviors. So what are other successful chapters doing? Looking at those, networking like you're doing now. So thank you for being on the call. Networking at professional conferences. So when you go to ARN, coming to the little outbreak sessions, chapter support session, your SIGs, seeing what's going on in other areas, utilizing the member circle to find resources, and then asking to attend joint meetings to share best practices. So I know Florida, we will often invite Georgia, and we've done some things with Alabama. I know Arizona, you guys have done some joint ventures with some other groups. It also gives you points on the scorecard, and you're learning from one another. And then, like I said before, using other models that work in your community, look to churches, community leaders, or other successful organizations. How do they attract people? And then what drives interest in your area? So when I was in Pennsylvania, it was a much different ballgame. People loved to volunteer. And in Florida, it's a little bit more difficult, especially in the urban areas like Miami, to get people away from their life because they spend so much time driving and there's just so busy. But in the countryside, it seemed it was a little bit easier. So you have to look at your area and see how you can make it easier for people to join. And I think that might be my last slide.
Yeah.
Thank you.
All right. Next is going to be Ellen from Northern California chapter.
Hi, thank you for having me. So I was assigned to go over overwhelming demands. And first slide, please. So strategies to reduce workload and prevent burnout. Oh, I should have said something about myself. I'm sorry. I'm at work, so I'm juggling. I'm a member of the Northern California chapter, and I'm a member of the board of directors and the board of directors. And in the past, I've worked with Donna. So thank you so much for having me speak. So strategies to reduce workload and prevent burnout. So you might notice at work or in your chapter that oftentimes it's the same people that will volunteer a lot. And those people can burn them. It's good to spread out the volunteer tasks. So sometimes a little bit of coaching or prompting some other people to take on a little bit is a good strategy. And then for the individual, avoid taking on too much. It's easy to say yes when you're excited and you're sitting at a meeting, but in reality, you need to think about how much time is that project going to take, and what do you have time to actually do that? So these are all ideas to prevent burnout. And after itself, avoid having too many big projects or events too close together. we've done this in our chapter before, but where we all said to each other, we need a break. We need to, like, before we to schedule the next thing, let's, we're just going to get worn out, and especially, oh, I work at Kaiser Permanente. We have a lot of CRRNs there, and we get most of our active chapter members have been from there, and then they'll be very involved at work too. And so, realizing that some of those people that are volunteering too much with us are also volunteering too much at work, or are scheduling too many things too close together. And then if you have a big project like putting on an educational symposium, which we do every year, you need to make sure that you do have enough volunteers so that the people doing it are just not frantic. And those can be, like Donna mentioned, even delegating little things to chapter members that aren't on the board that can do small things to help. So on that note, delegation and micro volunteering opportunities. So sometimes you have to assign tasks. We've done this before when we've had either a little bit of apathy, or just not enough people amongst our board, where we've divvied up tasks. So I'm just sitting here on this session, I've gotten some good ideas from all of the other speakers about maybe creating some more roles within our chapter. Sending out a call for volunteers to all chapter members. We do this. We do some volunteer charity work called Dignity Day once or twice a year, where we partner with other faith organizations and other charities to provide showers, clothing. During COVID, it was vaccinations to the unhoused population in the North Bay. And so getting our chapter members really enjoy that, and that's a way to get them volunteered. And it also is something on our scorecards that is on there. So that's another plus. Again, as a volunteer, don't overextend yourself and ask about the time commitment. What does this look like if you're kind of a new volunteer and you're not sure and you're hesitant? And if you're really new, you can pick small tasks to work on. We have one person who every year she does our brochure for our symposium, and that's her main volunteer task for the chapter. She's not on the board, but we can count on her every year. She does it for us. Another thing is when we have an event, having volunteers that will just be assigned to tasks on that day. If it's greeting people or checking people in, that's a great way for someone to volunteer. They don't really have to be an expert on anything. They don't have to public speak. They can just do that. Some of our success stories. So our chapter had 2 consecutive symposiums that were very successful with turnout, and we had great speakers. And then our third symposium that we were excited about got canceled due to the pandemic. So then we devised webinars where we got speakers to talk on different topics. And different people approached people that worked at their facilities, and just to see if they would be interested in talking. And our webinars went about an hour with time for questions and answers afterwards. What we have been doing for a while, we were because we have an active group at Kaiser, a lot of our symposiums were at Kaiser, but we were really trying to welcome and include and encourage membership and volunteering from other facilities. And we were starting to feel like people were associating ARN with Kaiser in our area. So we have reached out to places. And one way we've gotten people interested is by finding a hospital or a freestanding rehab unit and asking them if they would be interested in having our organization have our symposium at their facility. And we've done that now a couple of times very successfully, and we're doing it again this year at John Muir Medical Center in Walnut Creek. And so what we do is we end up involving the chapter members there that are on our list, but that we never hear from or see, and they'll be involved with giving tours of the rehab unit. And then we just get to meet them, which is great as well. So that's been very good, and it's a way to get chapter members involved in other areas. The Northern California is a huge area, and the Bay Area itself is even very big with a lot of traffic. And a lot of us are up in the North Bay, so we have a lot of facilities in the South Bay, and we now just have a new member from the VA that is down in Palo Alto. So we've got the opportunity to involve more people. And then we go all the way up to the Oregon border, and there's a rehab facility up there. And so reaching out and to their educator or their uh, DON and letting them know what we're doing and doing it ahead of time is really can be very successful. When we do our symposiums, our board members have been the ones organizing the event with participation from our chapter members that are often the same people that often volunteer. We divide up the tasks chronologically as the event nears. And that includes getting speakers, distributing flyers, and as we get closer, we have more frequent meetings so that we can make sure that we're on track, and we sort of reset our goals and see where we're at. But that's how we've been doing it. And one thing we have learned and is that we really need to start early with doing this, because we get more people attending, and we're not rushing around. We utilize certain members with specific talents to do certain things. I don't know that if it really was my talent, but I do keep track of our chapter website and update things. We have the person who does our brochure. We have a couple people now that do our brochure. And then we have one person who has been a case manager for a long time. She has a lot of connections with vendors. And so she helps us get our vendors that we have at our symposium. So we always have a couple of breaks, and our vendors are paying, and so it's income for our chapter, and it's actually been very, very lucrative and very successful. And the vendors get to, some of them are nurses. We let them have CEUs for attending as well. And then we have chapter members that work on little things, and these are some of the little ways you can volunteer. We have done gift baskets before, where some of our chapter members create those. They made potted succulents one year to put on all of the tables, and just decorated in general. So those are some of the things that we've been successful at, and we're continuing to try to engage our chapter members and think of new ways. We did a meet and greet in the middle of between the North and the South Bay over in the East Bay. And we got people that came out on a rainy day from the Central Valley, and we had a guest speaker who was an author and a rehab nurse, and we had pizza. And that was a very fun, and I think we would have had more people had there not been terrible weather. And I think that's the end of my slides. Thank you so much.
Thank you. So we're going to have Gillian talk to us from the Northeast Texas chapter.
Hello there. Yes, so I am currently located in Texas, but my background is I actually lived in Florida for 10 years before moving here. So the model that I grew up with was Florida as a state. So when I came here, I kind of had to learn that while Texas is huge, we are not set up that way. And I actually had to learn geography and figure out that I wasn't in the central Texas because that was the first chapter I reached out to, only to learn that no, Gillian, you're in Northeast Texas. So next slide, please. Um, one of the big things that I've worked on is collaboration with the other local chapters. Like I said, Texas is huge. You can drive 5 hours, 8 hours, and you're still in the state of Texas. I'm from the Midwest where you drive that many hours, you're in another state, but not down here. So back in 2020, when we knew or we thought we were going to be doing the conference in San Antonio, I reached out to the other chapters to try and set something up. So the Northeast Texas chapter, which I now know as my own, is the Dallas-Fort Worth area. There's the Southeast Texas chapter, which is the Houston area, and then Central Texas, which actually is in Austin, but also goes all the way down to San Antonio. So um, again, we were working on all that, and I'd reached out to everyone, and then the pandemic hit, and we kind of had to put that on the back burner. Then when we found out that the 50th anniversary was going to be in San Antonio, got everybody on board. We all attended and reached out to everyone again to see if we could set something up. So this over here is our little icebreaker that I had us do at our get together that we had at the San Antonio conference. We did it the night before the conference started at an offsite. And the reason I wanted to do a little icebreaker is because we're all humans. And I knew what was going to happen is each group was going to go and sit at their tables with the people that they know because we're human. So I forced people to go around and talk to other people. And then I had some lame little prizes from some San Antonio stickers that I got when I was on the Riverwalk. But anyway, so that was kind of that idea, and it came to fruition. It was a real success, and I'm hoping that we can do something similar going forward. Next slide, please. So again, we had this at a place called Elsewhere in San Antonio. So we had the 3 Texas chapters, and then it just has some pictures of the 3 chapter leaders of the 3 chapters, and then our chapter there, which was well represented. And the next slide, we also had a presentation by Mona Patel, and she is actually the founder of the San Antonio Amputee Foundation based on her story. So we not only had a social where we got together and had food and got to meet new people, but we also had a presentation, which was really very well received. Next slide, please. And then I call this the growing and going forward. To continue the relationship within Texas, we invite each other to virtual events. So our chapter in March had a presentation on disorders of consciousness. I shared that link to both of the chapters so that they could attend virtually. Southeast Texas has done that. I'm on their list, and we often join theirs. And then sharing the contacts. So earlier this year, Southeast Texas had a sponsor from a baclofen group reach out to her to provide a dinner and a presentation. Lolita, who I know from the board, reached out to me and said, hey, this is a contact, reach out. So I reached out, and we actually have a dinner and a presentation set up for September. And then I turned around and offered it to Central Texas, since Texas is all together, and they have something set up for, I think, August. So again, wherever you are, even if you're in a huge state like this, we can all work together and grow together and share what we have. And I think that's it. I think the next question is, or the next slide is questions.
Yeah. All right. So Anastasia, are we able to open it up for questions?
Yes. I
Okay.
think we have some in the chat, but we're open for questions. I want to make sure that everybody can unmute. if you can't unmute and you would like to ask the question, just let me know and I'll unmute you in the chat.
Are you available for questions?
Yep.
Yeah, I'm Erin. I'm a travel nurse. I'm a new CRRN last December, and I'm interested in this stuff. Well, how do you recommend I get hooked up being a travel nurse?
So where's your home?
My permanent address is in Columbia, Missouri, and right now I'm in Hazard, Kentucky.
Okay. Anastasia, I would think that my suggestion would be to join your home chapter and then maybe just reach out to chapters where you're wherever you're doing your assignment and see what's going on while you're there, because you're gonna just
Okay.
need a home base.
Okay. All right. So how do I do that? How do I find out my home chapter?
So what Anastasia, unless you think differently, call the 800 number, right? Call the national and just talk to member information.
Okay.
They can help you when you call them, and then they can also just add you to a chapter. A lot of the chapters are doing a lot of virtual presentations and things, so you may belong to one chapter, but you could also see what other chapters are doing. Sometimes we have it in our Pulse newsletter. It's in Member Circle, so just staying aware of what other chapters are doing might be fun for you as well, since you don't really have that home base.
Yeah, because I don't really see things posted, for ARN or anything associated with ARN. I mean, it's just kind of out there. Oh, you should get your CRRN, and then you kind of learn on the curve about ARN. So,
Yeah, right.
that's a little unfortunate. Because I feel like everyone needs to be a CRRN if you're going to be working in rehab.
So one of the things I would encourage you to do is really get on the ARN website and go to Member Circle. Have you been on there before?
Yeah, I think I've browsed through it. I don't
Yeah.
really remember right now.
Yeah, because there's a lot of different groups on there, and so you can get a lot of good information from it. But Anastasia's right, I didn't think about that. A lot of chapters are doing virtual meetings. So even though
Okay.
you're traveling, if you join your home chapter, you probably can do meetings from, wherever you're at. So
Okay.
I would call the 800 number for ARN and just talk to the information, whoever answers the phone, and let them know what you want, and they can connect you to the right person.
Okay, that's cool. Thank you.
Sure.
I put it in the chat for her.
Okay, thanks.
You're welcome.
Thanks.
How do you distribute brochures for your symposiums? We do a lot through email. We have the list of all of the members, and then I also keep a list of non-members who've been to our education conferences. And so we do all of ours through email, and then we'll reach out to other rehab organizations and even SNFs and home health in our and send them the flyer. Who was it else said? Ellen, I think you were talking. How do you guys communicate yours? Did she get off?
There, I was muted and I couldn't get unmuted.
Oh,
So we email, so we have, we're on Nursing Network. And so one thing we do is that not only does it go to all of our members and our prospective members, but we can select other disciplines that are on Nursing Network groups, like if it's education nurses or public health nurses. If we have a certain particular topic, we can select that so that all of our webinars and things go out that way. We also email, but I have gone around and driven to skilled nursing facilities in my area and dropped off the brochures and made face-to-face contact with their manager and done it that way. I'm planning to mail traditional mail because people get so many emails that now they don't get much mail. So it seems like it might be easier to see.
So this is Patty Higgins. Thank you for unmuting me. So I'm from the Southern California chapter, and I echo Ellen. Hi, Ellen. She's our
Hi.
Northern counterpart, and we're with Southern with Stephanie Lim there. We do a lot of the things that you all have been mentioning today. So this has been great to hear what other chapters are doing. We also subscribe to the Nursing Network subscription, and that has been a wonderful avenue of communication, as long as Ellen said, they don't unsubscribe to it because they get so many emails. But that is where we put all of our flyers. We rarely do a brochure anymore. It's a flyer. Then it's downloadable, and then it can be shared on the units. We do the same thing where we try to visit other rehabilitation settings, whether it's inpatient or long-term care. And now we're trying to reach out to home health care and other settings, so that we can get those flyers out there and get the communication out there. And for Erin, you can go on to Nursing Network and you can join several of the chapters. I don't mean that you're a member per se. I mean, obviously you're a member because you're here today, of the ARN, but you can become a follower of many of the chapters across the United States, and they all offer webinars, and you can attend the webinar as well. And quite a few of them are free for ARN members. So I wanted to make sure, and Stephanie may have something else to add to that, but we are trying our best too. And our membership did go up about 15 this past year, which has been great for us. But like all of you, we're in the like 100 to 110 in our chapters. So we're always looking for great ideas. So thank you for today.
Hi. So you say, I'm sorry, this is Erin. You say Nursing Network, is that nursingnetwork.com?
Yes.
Yes.
It's the website for the different chapters.
Yes.
Okay.
And you could shoot out events and you could shoot out messages. There's a way to do it as a moderator. So anyone that's a follower or a true member can get that message. And when we do a lot of free CEs and we do the same thing, I shoot it out to the followers, obviously. So my philosophy is the more people that, attend, the more likelihood they might be willing to join down the road. I do have two questions. First of all, I think this presentation was very helpful, so thank you for those who put it together. It would be nice if you could share this with the chapter leaders. I'm going to share it with my chapter. I'm from Northern Illinois, and I feel like there's some important tips. We're very fortunate. We have over 200 members because there's a lot of rehab nurses in the Chicagoland area. And so not all of the people that are chapter members are part of the followers of NIARN website, unfortunately. So I do use the email list that Sharon, the chapter support leader for our group, sends out. And I do send out information that route, and I do send it out through the network, the website network. But, it's a little bit of a pain for me to shoot it out via email because I could only send out 50 at a time. But I am interested, I don't think there's a better way to send it. I think it's more of the way my Outlook is set up. But for those that do send out text blast, and I know that's important, not everybody wants to receive text, obviously, so you have to ask their permission. But is there an app to help you with that?
So Patty
Yes.
says she uses a multiplier text service. So maybe she can explain that to us because I don't know that either.
Well, we do have a person that's designated that coordinates that, and we have to pay. You either will pay a monthly service rate or you'll pay as you go. And we've chosen to do pay as you go because we probably use it 4 to 6 times a year. And of course, as Susan mentioned, you have to get permission from the chapter member or to opt in, just like ARN was going to do with all of us, which I haven't seen too many texts. But it's called Multiplier. And I know, Stephanie, you're on the phone. Are you going to say anything else, or are you still muted? But anyway, just go ahead and contact Stephanie Lim or myself, and we'll get you in touch with our board member who's in charge of it.
Okay. And for anyone who's not on the Nursing Network website, it's such a wonderful tool to have people sign up for events. I highly recommend it. We've been using it for years now.
And us too. Love it.
So I think this presentation will be available on the ARN website, but Anastasia, is there a place where we can just have the slides also so that they could grab the slides?
Yes, so I can distribute the slides along with the presentation. So this presentation was open to both chapter leaders as well as all chapter members, but there is a location online where we have a chat for chapter leaders only. So when you sign in, only chapter leaders can access those resources, as well as member circles. So I'll also put them on there, but then I'll distribute them to all chapter members as well.
Okay, awesome.
One quick question. I know we have to have our scorecard in soon. I can't remember the date. I did get an email from Sharon. I just want to make sure I get it in on time. Is it?
That's the next slide, Beth.
Yeah, I guess when she said that, I'm like, oh, let me move to the slide. So the deadline is July 14th, 2025.
I was on the chapter scorecard committee as chair, and we developed the scorecard. I just love the scorecard.
Yeah. And then we also want to remind you guys about the chapter leaders event at the in-person conference in Phoenix this year. It'll be August the 1st, and it'll be at 12 o'clock Mountain Time, and it'll be a box lunch will be served. If you're a chapter leader, if you can attend that, we would love to have you attend. And let's see, what else are we gonna, and then if you haven't got your financial report in, those were due a couple months ago, actually. So if you can check with your chapters and make sure that that has been submitted. If not, it really does need to get submitted. It's way late.
And thank you for being chair this past year for the committee. Good job.
Yeah, it's been fun. We've had a great group. So if anybody's interested in joining it, it is a great group to be on. So, all right, Anastasia, anything else? Stephanie?
I think that's all. This was great, everybody. Thank you.
Okay, awesome. Thank you guys so much for joining.